Quali sono i dati provenienti dalla pratica clinica quotidiana, la cosiddetta real life, per quanto concerne i nuovi anticoagulanti orali utilizzati nei pazienti con fibrillazione atriale? Ecco, qui a Londra, al congresso annuale dell'ESC, della European Society of Cardiology, è stato presentato uno studio molto importante che prende il nome di Xantus, effettuato proprio per valutare il rivaroxaban, uno dei 4 nuovi anticoagulanti orali, proprio nella vita reale. E noi ne parliamo col professor John Camm, professore di cardiologia alla St. George University di Londra e principal investigator dello studio Xantus. Professor Camm, why you decided to perform the Xantus study? You already had the Rocket AF data regarding rivaroxaban, so why do another very important study and also expensive?
When a new drug is introduced into the clinical practice, it's very important that you monitor the effect of this drug. This is in many ways a regulatory requirement, and the Xantus study was designed in that context. As you know, the Rocket AF trial was a previous approval trial, a phase 3 trial, in which rivaroxaban was compared with dose-adjusted warfarin, and the results from that trial were quite sufficient in order to gain approval for this drug to be marketed as a non-VKA oral anticoagulant for use in patients with non-valvular atrial fibrillation at risk of stroke and systemic embolism.
Professor Camm, which type of study is Xantus study? So, how it was conducted, how many patients, and more important, which type of patient have been enrolled?
Xantus is a registry type of study. It is prospective, and it is non-interventional, and it is observational. It is a trial which gathers data from over 6,700 patients who are initiated on treatment with rivaroxaban. The treatment lasts for 1 year in most of the patients, and data are collected at entry to the study, at hospital discharge, and quarterly for 1 year. The data that we are collecting predominantly concerns outcome events such as stroke and systemic embolism, major bleeding, and all-cause mortality. The study enrolled 6,784 patients who were followed in this way, and the stroke rate altogether was 0.7% per year, and the major bleeding rate was 2.1% per year. Both of these figures are rather low. If we clump together all of the major events for the whole year, we can see that 96.1% of the patients suffered none of these events. In other words, they had a completely free year from events.
Which are the differences in terms of result between the Xantus and the Rocket AF, and why there are these type of differences, in your opinion?
The results from the Xantus trial are different from Rocket AF in that major bleeding rates, stroke rates, and mortality rates are lower than in the Rocket AF trial. The main reason for this is, of course, that Rocket AF enrolled patients at much higher risk than the Xantus study. The reason that Rocket enrolled a different group of patients was that this was the selected group of patients for a study that would be used to approve the drug. But having got that data, it was then very important to look at another group of patients, which was a more average group of patients with atrial fibrillation. And the Xantus study enrolled those patients. Just to put a figure on it, if we look at the risk profile of the patients, the CHADS-2 score in Xantus was 2.0, whereas in Rocket AF it was 3.5. So you can see it's a very different group of patients.
Finally, Professor Camm, a comment regarding the Xantus study. These data are compelling from your point of view. Which is the message that comes from this study?
The Xantus data are extremely reassuring. It's always critically important to keep an eye on what is happening with the drug when it's first introduced into practice. And we see from these data that stroke rates, systemic embolism rates, major bleeding rates and mortality are all in accordance with what we would expect from this group of patients treated effectively with an oral anticoagulant. So the bottom line is the Xantus data is extremely reassuring.